Hello, good evening. Good evening to all my dear students. Myself, Dr. Karthik Vijayakumar. I'm the endocrinology faculty at Doc Tutorials. As you know, you're all gearing up for the very important exam, INI SS November session for the year 2025, or rather, it is better called as the January 2026 session, which is going to be held on 22nd of November, just 3 days from now. And all of you must be in the last lap of the preparation. So we at Doc Tutorials have just organized this session, not for the selection of topic discussion, for last minute revision, for any discussion of important points. It's not like that. So the goal or the purpose for this session is just see so many students have messaged me. A lot of faculty have received the message from the students that they are really confused on what to be done. Like in the last couple of days, what should really be their goal in the in the actual exam day? How much questions should they attend? And what should be the expected score? We are getting a lot of queries from the students. So we thought, just like if I am appearing for the INISS examination, which I did a few years back, so what would be the thoughts in my mind, how I would plan on attending the exam, and how I would spend the last couple of days prior to the exam. So I just thought I would share what my insights would be on this day, the last minute strategy, tips and tricks. And I like, once again, I'm emphasizing, I'll not be touching on the important topics. I'll not be touching upon the areas which I feel are like more likely to ask to be asked in the question. Just the discussion on how you should feel, how you should take the exam, and how you should stay composed throughout the exam. So in the next, say, 15 minutes or so, it will be a very small session. I'll try to keep it as simple, crisp, and short, because I don't want to waste your precious time in the last minute revision. So with this, we'll just brush through some of the topics which I feel are important. So if you have any queries pertaining to this area, you feel free to type the question in the chat box. Okay. So this is pretty known to everyone what INISS actually test. So you'll have 80 questions. There is no exact demarcation on what would be the number of questions from your core specialty, what would be the number of questions from general medicine. But on an average, based on a previous experience, it would be around 50 to 55 from your super specialty of choice and 25 to 30 from the general medicine, which could come from Harrison and sometimes from recent advances and from guidelines also. So the ranks for the INISS depend heavily on the accuracy or your depth of your core subject, depth of knowledge in the core subject, the rate at which you are able to get the medicine questions correct, and very importantly, the time management and question prioritization. So you could have all the time in the world, you may have assimilated all the information on your specialty and in general medicine, but your performance on that particular day is the main thing which fetch you the eventual rank. Because I have personal I was in touch with so many students who would be doing extremely good in their preparation phase, answering all the questions in the groups, but on the day that mattered the most, they fumbled or they crumbled under pressure. And I don't want any of you to be in that situation. So that is why keeping a cool head during the exam is of utmost importance. So why did I say that the 25 questions from medicine are rank deciding? So it's because everyone reads their specialty well, because they would have spent at least 60, 70 percentage of their entire preparation time reading their core specialty. They may have already gone through the specialty textbook. They have gone through the entire Q bank. So the scores for that specialty tends to cluster very tightly. So if I am to elaborate further on my specialty, endocrinology, so out of the 55 questions, many a time the toppers would be scoring around 50. And there were sessions the toppers have got all but one or two questions correctly. So such is the high scoring nature of your specialty of choice. There is absolutely no element or room for error as far as your core specialty is concerned. Whereas the medicine could be slightly more difficult than your core specialty, and out of the 25, many a time even the toppers would be able to get only around 17 or 18. They could be getting 7 or 8 questions wrong in medicine, and I feel anything around 16 to 17 from the medicine part is a very good score, because I expect all of you to score at and around 85 to 90 percentage for your core specialty. That has been the trend for so many years. When we go through the topper scores and we talk with the ones who have eventually got the marks, many of them are scoring more than 90 percentage for your core specialty, and any score at an in and around 80 percentage for your medicine is extremely good. And there is a slight difference in the pattern of questions being asked from the medicine for the INI versus NEET SS. NEET has a whole gamut of topics, very unpredictable. Question can be asked from any nook and corner on of Harrison and much more. But for INI SS, if you look at the previous years, there are certain areas where questions come repeatedly, like the acid-base balance, the renal tubular acidosis, and some like the toxicology. So those questions, and even multiple myeloma, at least for the last preceding 2 to 3 years, there were like questions on multiple myeloma. So if you go through the previous year medicine recall PDF, you'll get to know the high yield areas, and the question tends to get repeated from the more or less the similar areas in INISS. And that is exactly the reason why prior to the previous April session of INI, all the faculty and doctor tutorials have done an individual question selection session for general medicine. So I request each and every one of you to go through those sessions if you have all not already done so. Okay, it is available as YouTube Live and been uploaded in the app as well. So that selection of question from the medicine section, please go through those important areas and make sure that you haven't missed any one of those. Okay. So the last 3 days, what to study for your core specialty, very difficult thing, because you are a very heterogeneous group, and it may be difficult to give a list which can satisfy all of you. But I suggest at least stick on to the last point. There should be no new chapters now. So you go through the highlighted portions in your notes. I'm pretty sure most of you must have bookmarked MCQs from the Doc Tutorials app, from the GTs, the questions that you have gotten wrong, the concepts you tend to get wrong. You may have bookmarked those questions. So now it is the time to go through those bookmarked questions, highlight portions in your note, and very important, not to miss out on the past year recall PDFs. So just go through if you don't have the PDF, at least go through the revision, the recall videos at 2x or 3x speed. Because even if they don't exactly repeat the same question, but there are clustering around the similar topic. For example, in endocrinology, at least in the last 4 to 5 sessions, there has been no paper without a question from DST. So DST, you just have 7 or 8 conditions. If you know how they present, there will be a clinical scenario and you will be able to crack the question. Likewise, there will always be a question on hypercalciuria, renal stones, and certain table in Williams, which I have emphasized every time. And there would be a question on pediatric genetic syndromes causing short stature. So such areas you will be able to identify if you go through the recall PDF. At least 4 to 5 previous sessions, I believe all of them are uploaded in your Doc Tutorials app. And I think all of you must have already gone through that. So please go through the notes that you have prepared from those videos or the recall PDFs that you already have at your disposal. Then it is also time to go through the cutoff algorithms, which you tend to forget. Certain cutoff, for example, the insulin dependent hypoglycemia, the values, what is the value of insulin and C-peptide? What is the diagnostic cutoff in acromegaly? I'm citing endocrinology because it is my specialty. It the same goes to everyone across all specialties. Okay, so go through the cutoff that we have already making a note of. And very important, no new chapter reading in the last 48 hours. And what about medicine? So the Harrison tables and charts are of utmost importance. Again, I believe most of you would have a medicine notes on your own, either by reading of your Harrison, the ones you may have prepared for your NEET SS preparation, or the highlighted areas in your long video notes. And as I told you, there are doc tutorials faculty videos on high yield medicine topics done in 2025. Okay, please go through that to get a selection of the important areas where the medicine questions from each specialty is likely to come. Okay, and last but not the least, don't never forget to go through the medicine recall questions, because at least 2 to 3 questions would be a recall of at least last 3 to 4 sessions every time in INI SSS. So please do go through the medicine recall questions. Now, a very common question from students: should I attend all 80 questions? So again, there is no single answer. It depends on the difficulty level of the paper, which is like very difficult to predict also. But looking at the trends, at least from the time that I've started teaching for doc tutorials for the last 3 to 4 years. So even though there is a negative marking of -1/3 for each wrong answer, when you go through the toppers, when you speak with the toppers, when you do their interviews, most toppers attempt 75 to 80 questions. Because this is not neat assess, which you are talking about, where you want to minimize the negatives. Here, only the most creamy layer gets selected. Once you get the digit ranks, or at least in the first 20 ranks, are the ones who are going to get a seat from INI. So it is nothing but do or die or all or none phenomenon. Either you get a very good score or you fare very badly. So I don't think it is a right idea to say attempt like 60 questions, 65 questions, and leave the remaining 15 where you have any doubt. Because if you attend 65 questions, the most you are going to get correct is around 60, the most. And the topper, or the ones who are eventually going to get a seat in endocrinology or any specialty for that matter, would have already gotten like 65 answers correct. So you are not going to get a seat. Or else you need to have 100% strike rate on the questions that you are attending, which again is extremely difficult. So I suggest try to attend maximum number of questions and never skip critical reasoning MCQs, because there is always going to be a catch. And even if you make a logical guess after excluding the option, you are more likely to get correct than not. So avoid skipping clinical reasoning MCQs. So once again, I am putting a disclaimer that this is what exactly I feel if I am to attend the INISS. A different faculty or a different student may have their own perspective, but as I told you at the outset itself, this is how I would go about approaching the exam from the experience that I have in appearing for the MCQ examinations. And skip the questions that have ambiguous one-liners. Sometimes I've seen very haphazard, very specific theoretical points like the percentages, where there is hardly any chance for you to get it correct unless you are being very lucky or you have gone through that exact same point from the specialty textbooks. So in such questions, like there is an option of 10%, 15%, 20%, 25%, those close options, very difficult to have a correct guess. So in those situations, I think it could be worth like skipping those questions. Or questions from topics you haven't read at all, you have no clue about the questions or the options, you are not able to exclude two options, then of course you can think of skipping it. But if you are able to narrow it down to two options, I suggest you go for it. Okay, that is what I would have done in the same situation. Now, there is always a challenge in reading the long question, because INI often comes with two set of questions. One, a long clinical question, and second would be a statement based question. You will be asked to identify the true statement or the false statement, which would be the next best step. So, such questions are part and parcel of INI. So, very important, you have to remain focused. Please don't keep the baggage of the previous question or the previous set of difficult questions while you are reading a current present question. So avoid reading in panic. Be focused and stop thinking about the question which you may have gotten earlier, or there could be one point you may have forgot while attending the previous question. So please leave those baggage and try to focus on the current question. And what I would have done, I would always read the last line first to see what the examiner is asking. This is very important. So a long clinical question would be unrelated to the final thing which is asking. I would give an example. The question would be about like a familial hypocalciuric hypercalcemia. There would be a long clinical history giving the calcium, the PTH, urinary calcium excretion, but the end or the final question would be which of the following is not true regarding this condition. So there will be enough and more clues in the question to say that it is this condition. So you would not waste some unnecessary time if you are going through the last point first. See what the crux of the question is about. Then you can save a lot of time and go straight into the options. So I'd be going straight into the last sentence and the options first, and then go retrospectively on the question. So when you go through, have a glance at the options, you can focus on the question better. Okay, so sometimes the options are extremely haphazard and different. So even a very difficult appearing clinical question can be made much easier if the options are not very close. So that is one beauty about the MCQ. Even if you have no clue about the question whatsoever, just looking at the option may help you get the right answer. So always read the last line and go through the options first, which can save you a lot of time. Okay. And it is important to scan the stem for key triggers. Always look at the age, the ailments the patient is suffering from, the labs, and the medications, because these are the common things which would be the answer deciding ones, or the areas where the clues tend to lie. So at the end of the day, you should be able to summarize the question into 5 to 6 keywords. The question could be of 5 to 6 sentences, a very long question, but you should be able to like summarize it into 5 to 6 keywords. If it is a case of Liddle syndrome, you need to summarize it into hypertension with hypokalemia, low aldosterone, positive family history. So by this way, you can narrow down the options and get into the right answer. And always important, recheck for traps. You should not confuse between what is true, what is false. When I go through the recall questions, day of the exam, when the students all start posting their questions on the WhatsApp groups, even many students are confused as which was actually asked in the exam, whether it was true, whether it was false. It's because you are not focusing enough on the question. At the heat of the moment, you are tending to lose focus, and that should not happen. The question would be known to you. You would have already known the answer. But at the heat of the moment, if you are mistaking between whether the question was about true statement or false statement, you can get it wrong. That is the reason why going through the questions on a second time would be helpful for you. I'll be coming to that. Now, should be the strategy for difficult questions? Again, it is very easy to say and to present this as a PowerPoint, but on the exam day, when you are facing a difficult question, I can bet you it is very, very difficult. So the things you can do initially is to eliminate the extremes. I think all of you are already familiar with these. So eliminating the extremes, because I've thoroughly gone through the options and the questions for the last 3 INI, and it is obvious that at least 1 or 2 options are exaggerated and absurd. So that is why I've told you it is very easy to exclude one or two options to narrow it down to two options. And always try to do reverse reasoning. Instead of asking yourself what is the correct answer for this question, look at the options and ask whether this can be right or wrong, whether this can fit the clinical condition in question. So that would help you get an answer in a better fashion. So whenever there is a statement which is too absolute, always, never, that is more often wrong than not. Or very vague statements which contradict established physiology are all less likely to be answers, because I most often have straightforward answers and less convoluted statements to be asked in the exam. And one interesting point which I have noted is that there are often many typo errors in the options and questions. But the correct response or the correct option, very unlikely to have a typo error, because they always go through the keys once again, the key once again. Because I have been in touch like with the students and the faculty who have prepared the questions for the previous years and all. And when I spoke with them, they always go through the key once again to see if there are any typos. So typos in the answer less likely to be. Again, this is not an absolute rule or anything. Just from my from my experience and talking with the other people who are like closely related to this. Okay. And time management, you have 80 questions to answer, you have 90 minutes at your disposal. So always try to have at least 3 pass through the questions. The first pass, the 80 questions, you try to finish in 60 minutes, because many a time you may have made silly errors. Like you could have mistaken true statement for false statement, or except that keyword you could have missed on the first look. So if you are able to have a multiple passes through the same question, you will be able to like get those silly errors correct. So many students after like attending the exam would give feedback to me, sir, I've made 3 silly errors, I haven't read the question properly. So if you can like afford second and third pass, so in the first hour you should at least glance through all the questions once. Okay. And never get stuck in at more than 60 seconds on any question, because this happens very commonly. Like one question would come from an area that you are very familiar with, and you will be obsessed on getting the right answer for that. But at what expense? You will be cutting short the time for the easy questions that is coming later on. So if you are spending 90 minutes or 120 seconds for a single question, actually you are encroaching the time for the next question, and there is a high chance that the cost of getting one question right would be not getting enough time to getting 3 or 4 questions correct later on. Okay, so very important, never get stuck in more than 60 seconds. If you feel it is taking too long, like then it is very important that you move on to the next question and come back to this question in the second pass, and by that time your concepts or the clarity would have been much better. So never get stuck at more than 60 seconds on any question. Now, common mistakes to avoid. So many people may feel that INI is set by the AIMS board, so they are bound to ask tough questions. So if you are seeing a very simple, straightforward appearing question, you will ask yourself 2 times, 3 times whether this is the right answer or there is some hidden agenda in the question. So very important, don't overthink on seemingly simple questions, because 30% questions even from INI are very easy and straightforward. Okay, so don't spend too much time on seemingly simple questions just to think whether could be anything behind it. Okay, and second thing has helped me hell of a lot while attending my entrance examination. Don't change answers in revision unless you realize a factual mistake. If there is a gross mistake which is regarding fact, or you have misread the question or something, your initial hunch is most likely going to be correct. Because I've had so much experience, I believe most of you have the similar experience too. So I'm not telling never change, but from my perspective the thing that first comes your mind is most likely going to be the answer. And very important, don't panic if the first few questions are hard. It's very normal, because there is no like even clustering or even distribution of questions for INI. They could be having a clustering of all the difficult questions in the initial 10 or 15 ones. So you would be thinking, in the 15 questions, I don't know 5 questions. So what would be happening in the next 65? So you need not think like that. The next 65 would be a cakewalk for you. So very important not to panic if the first few questions are hard. That is why NEET assess that is why NEET assess the students who tend to get the easy questions upfront are likely to fare better in the exam altogether. So don't panic if the first few questions are hard. And the exam day plan, these are pretty generic and basic advices. Sleep early the night before. You might be traveling on the day before. Okay. And if you are traveling on the day in the early morning, be sure to take a light breakfast. You may be taking food from outside. It's always important to have a good stomach and take a light breakfast on the day of the exam. And don't like leave it to the last minute on reaching the center. Make sure you are there at the center at least 1 hour early. Okay, you don't want any other confounders, any other distractors. You don't want your mind to get tensed just before the exam. Okay, so make sure you are reaching the center at least 1 hour early. So I agree that these are like like very basic things, and some of you must be wondering, but these little things are important. Even if a single student is reaching the the exam center very close to the time, I can, because I have done so in one of the occasions, and I can imagine the stress one would be going through even while attending the exam. And very important to stay calm and steady throughout the exam, from the first to the very last question. So your level of focus, I know it's not easy to do, but you should be attentive to the last question with the same level of focus and concentration with which you have attended your first question. So, if you're able to maintain that through the entire span of the exam, you are more likely to come out with flying colors. And I had panics many a time in between the exam where there is a surge of very difficult question. In such situations, closing the eyes for just 10 seconds and taking deep breath and reset will help you restore some iota of calmness. So I'd be summarizing this up with the golden rules which I feel are important for the coming INI. So attempt higher number of questions. Try to solve like maximum questions and leave alone only the questions which I have already discussed to you about. So the medicine is rank deciding. So in the next day, in the coming couple of days, one of the days you spend for medicine, looking at the previous year questions, if you have not already done so, identify the high yield areas, just glancing through the videos by the faculty of doc tutorials, because it is an extremely rank deciding one. And try to get around 20 questions correct from medicine. That would be extremely great for your final rank. And very important to trust your preparation while going through the exam. Don't like try to evaluate the toughness of the paper. Okay, so your preparation is the important, because this is such a vast exam. You cannot predict exactly where for the question is going to come from. The level of preparation of each person is going to be different. Okay, and you cannot vouch for the paper to be easy, medium, or tough. It can vary from time to time. So you have to trust the preparation. You have to believe in yourself that I have made this much effort. I have put in this much effort for this duration of time for appearing for this exam. And it is time for me to show my worth. So try not to evaluate the paper and trust your preparation and go for the jugular. And very important, last but not the least, keep a cool and calm head. And one tough question doesn't decide the exam. That is why I've told you to leave the baggage behind of the previous questions while you are attending the current question. So I agree that these are pretty basic and generic advices, but still, I believe that some of you must have been needing some sort of hand holding, and that is why we have decided to conduct this session. And I'd be happy to answer any questions or queries, not about the choice of topics or anything, but any like strategies which you feel are important for the exam, which I missed out. If you want any clarifications, I'll be happy to answer. So one of the doctors have asked what to follow, aggressive approach or safe margin. I think I have already answered that. This is like all or none phenomenon. If you want to get into the top 20, try to attend maximum questions, because if you're getting too much negative, so be it. So be it. So either you win or you lose. If you're getting a seat or you're not getting a seat, you have another exam coming on your line in the form of NEET SS, where you have to take a slightly more conservative approach. So here I would be in, or I would be for an aggressive approach for INI. So anything else? And I really hope all of your preparations are going really well. So about biostatistics, again, there can be last time there was no questions from in the endocrine paper about biostatistics, but there is a video in the QRP session, around 2 hour long video on biostatistics done by the PSM faculty. Like I cannot say, because at least a couple of sessions back till then, every time there will be 2 or 3 questions. Initially, they started asking from the very basics, the parametric, non-parametric test, and then like they had certain very difficult questions also asked from biostatistics. So just a 2 hour long video, you can watch it in 1.5x speed. I think that would be more than enough. So inborn errors and metabolism topics for endocrinology, I think I have already shared a PDF in one of the groups. So I'll be sharing in my endocrinology group again the PDF on inborn errors and metabolism, the most important the MCQ points which are likely to come. Usually, inborn errors of metabolism are not a favorite topic in INISS. There has been hardly any questions. Of course, some questions on like a glycogen storage disease, which we already have covered under hypoglycemia and all, have been asked. And the pure metabolic disorders like the lysosomal storage disease, mucopolysaccharidosis, and all are very less likely to be asked. But I'll be sharing the PDF in the group. So regarding the like the medical trials question, again, uh, the recall PDF, I think the PDF that I have with me is have just the questions alone, because I've taught it in OneNote. So I've just written down the answers, explanations, and also that won't be having the explanations. I think the recall, everything has been uploaded in the DocTutorials app right from INI SS 2023 onwards. 23, 24, 25, 3 into 2, 6 sessions are uploaded in the DocTutorials app. So please kindly go through that. And any the PDF I'll search in my system. Just the question PDF recall I may have in my system, which I'll be sharing in the group. So anything else? So once again, I'm wishing you all the very best. So please stay calm. You have done a lot of preparation. You have been reading a lot for NEET SSI. Know many of you individually preparing for the exam. You have put in a lot of effort, and you should put in your best on the exam day itself, because all these months of hard work and dedication and hours of sleepless nights, so it is going to gain fruition if you are able to perform well on this D-Day. So all the very best. So the couple of days, the revision, you may have your own strategies, but if you don't have one, you can follow the ones which I have just enlisted in this PowerPoint. And very important to sleep well prior to the exam. Okay, prior to the exam, you should have at least 7 to 8 hours sleep. That is very important. There is no point like studying till early morning on the day of the exam and just sleeping for 2 to 3 hours, and that will actually hamper your recollection and all. Okay. So Rahul sir has also joined in, and sir has also wished good luck to everyone. Thank you, sir. So thank you all once again. All the very best, and we'll be connecting with you in the individual WhatsApp groups. And right after the exam is over, we'll be collecting all the questions and we'll be doing the recall sessions also as early as possible. So thank you all. Thank you.